Hi, everybody. I'm Lindsay Houff. I'm the Senior Policy Manager at NCCS. And today is my favorite day of the whole symposium because we really dig in deep into the policy issues and we kick off Hill Week. I know so many of you and have gotten to work with you over the years, and I'm really bummed that we can't be together in person this year, but I'm so grateful that you've taken time to be here virtually. This has been a great event so far, and like I said, I'm really excited about today. But I also wanted to share with you a little bit about why I work at NCCS and what this work means to me. When I was 9, my dad was diagnosed with melanoma, and 2 years later, he died. And I just, as a parent now myself, I just can't imagine what my mom and my dad went through as they were raising 3 young kids and battling cancer. In the past couple years that I've been working at NCCS, my mom has been sharing more and more about that experience for her as his caregiver. And she shared with me her journal that she kept throughout his treatment. And I was reading it, and it was just really incredible to read. And it just dawned on me. And I told her, this is what you were doing was care planning. And that's something that, we push for and we fight for at NCCS. Like, this is the work that I do. And, for her, she obviously didn't see it that way. It was this journal, this care plan was just a lifeline. And it was keeping track of, every important visit and every treatment. And it included a lot of details about a clinical trial that he had enrolled in. And at the time, it was a brand new science called immunotherapy that no one had ever heard of, which is amazing to think because now we all know what immunotherapy is. And it's also, kind of amazing but heartbreaking for me to know that if he was diagnosed today, that he would have probably lived a lot longer. So it just, really ignites the passion for the work that I do at NCCS. In my office here, I have a big picture of him that just reminds me of, why we do this work. And a lot of you know that public policy can be difficult and frustrating, but working with you all makes it really amazing. Sharing your stories and working with the advocates in the CPAT program to make sure that the patient voice is heard and that we are constantly improving cancer care is just so important to me. And I know it's important to you. And so I'm just grateful that we get to work together and that you're here. And we look forward to all the fun policy stuff that we will dive into today. So thanks again for being here and for sharing your stories and sharing your experiences with us.
Hello. I just wanted to spend a couple minutes telling you a little bit about what motivates me and what my why is in working with NCCS and on behalf of cancer survivors. I lost my best friend to cancer 8 years ago when he was only 43 years old. And I saw some good elements of the cancer care system and then also some of the flaws in the system where he didn't always get the care that he needed. My uncle, who's very dear to me, is in hospice care right now after dealing with head and neck cancer for about 4 years. And he's had a really, really rough road. And I see a lot of things that he didn't get that I think he should have gotten that could have made him more comfortable, that could have made him have a better quality of life. Head and neck cancer is really rough, and he's had a really, really horrible quality of life for the last 4 years. And I wish that it had been better for him. And I feel like we can do better for cancer survivors and people living with cancer. And what really motivates me every single day is working with all of you, with the advocates who really donate so tirelessly of your time and energy and passion to help other people who are going through the same thing that you're going through or that you've been through. It is your constant motivation that inspires us every day. I know that being an advocate gives a lot back to you as advocates, as being an advocate gives back to all of us at NCCS as well. And we're just so grateful for all of you for what you do in your communities and what you do in research, what you do on a national level, with sharing your voice and helping other people to go through the same experience that you've had. So thank you very much.
Good afternoon or good morning, and welcome back to our fourth and final day of our virtual CPAT Symposium. We knew that this year would be different since we wouldn't be able to see you all in person, but this has been a great way to connect with you, and we're grateful that you've been so engaged throughout the entire program. We really appreciated all of your questions that you asked yesterday in our sessions, and we appreciate you spending your time with us and your engagement. I'm excited today that we're going to dig into some of the policy issues that are important to cancer survivors. We get to put all the knowledge we've learned throughout the symposium into action, and today you'll learn how to be an effective advocate. Even if you're not participating in Hill Week, these sessions will help you learn about the policy issues and how to share your story. There will be other ways for you to share your story with your elected officials even after Hill Week. We know that some of you are new to advocacy and some are pros and have been involved for many years. Please take a second to answer the poll question on whether you've met with your members of Congress. We'll check back on the results later in the program. And now, before we kick things off, we have a special message from two members of Congress who are not only our champions, but also our cancer survivors themselves. First, we'll hear from Congressman Jamie Raskin from Maryland. He represents the National Institutes of Health and Silver Spring, where the NCCS offices are.
Hi, it's Congressman Jamie Raskin from Maryland 8th District. Just reaching out to say hello to all my friends at the National Coalition for Cancer Survivorship. We've met many times before in person when you do your cancer policy advocacy symposium and bring everybody together. I'm sorry we're not able to meet in person this year, but as a fellow survivor who did it all, chemotherapy and radiation and surgery, and having gotten to know a lot of people in your group, if there's anybody who knows how to get us through this terrible crisis and nightmare, it's cancer survivors. It's people who've gotten used to fighting every day for personal, physical, and medical survival, as well as financial survival and social survival and family survival, and then nationwide and global survival. So the cancer survivors have a critical role to play in getting America through this crisis. I thank you for your leadership. I thank you for your advocacy, and I look forward to us being able to meet in person again when we get through the pandemic. All best.
We're really grateful for Congressman Raskin. He's a fierce champion for cancer survivors and for funding for research at the National Institutes of Health. So next, we're going to hear from Congresswoman Debbie Wasserman Schultz, who's a breast cancer survivor from Florida and a longtime champion for cancer survivors.
As a breast cancer survivor and a member of Congress, it's an honor to send greetings to your first ever virtual conference. As we all know, the COVID-19 crisis has dramatically changed our lives these past few months. This is especially true for cancer patients, caregivers, and survivors who must take extra care to protect ourselves from infection and to navigate ongoing care in a healthcare system turned upside down. However, Americans, and cancer survivors especially, are strong and we rise to any challenge. And I know the important work you do as patient advocates continues, stronger and more determined than ever. As many of you know, I am a cancer survivor myself. In 2007, when I was only 41 years old, I was doing a routine self-exam and found a lump, which turned out to be breast cancer. I also discovered, like many other Ashkenazi Jewish women, that I carried the BRCA2 gene mutation. After surviving 15 months of surgeries and treatment, I was cancer-free. But as any cancer survivor will tell you, beating cancer is only the beginning of the journey of cancer survivorship. For me, it was also the beginning of a mission to translate my experiences into something greater than myself. I wanted other young women to have better access to information and the tools to detect, fight, and survive breast cancer. That's why I introduced the Education and Awareness Requires Learning Young Act, or the EARLY Act. The EARLY Act is designed to help educate healthcare providers about the specific threats and warning signs of breast cancer in younger women that lead to early detection, diagnosis, and survival. This Congress, we are working to reauthorize the EARLY Act with increased funding for a total of $9 million for breast health education programs. Cancer survivors know better than anyone that beating cancer means a new opportunity to live life in healthy and fulfilling ways. The number of people who survive cancer is thankfully increasing, but too many obstacles remain between cancer survivors and the continuing care and support we need after we transition away from active treatment. That's why I'm working on comprehensive cancer survivorship legislation to better understand the transition between patient and survivor, break down the barriers to continuing care, support survivors as they build their post-cancer lives, and empower cancer survivors to live those lives in full and healthy ways. For me, the journey of survivorship continues to mean doing everything I can to champion the prevention, detection, and eradication of cancer. It means finding new and innovative ways to educate and empower patients and survivors before, during, and after diagnosis and treatment. It means ensuring that education, prevention, detection, and treatment are available and accessible to all, regardless of race, ethnicity, socioeconomic status, or age. For me, the journey of survivorship means combining my experiences as both a cancer survivor and a member of Congress to make real change that helps more Americans survive cancer and more survivors thrive. Thank you for your work as patient advocates. We need your voices and we need your advocacy. Stay well and be safe.
Hi, everyone. It's so great to see you again, and it was lovely to hear those messages from our champions on the Hill. And now we get to hear from our personal champion and colleague, friend, resident DC insider, Zack Marshall. Zack is the policy director at the Prime Policy Group. His portfolio there includes healthcare, agriculture, trade, and transportation. He is a Hill veteran, or Zack, maybe you say you're a recovering Hill staffer. Most recently, he worked with the Office of Representative John Yarmouth, and he spent more than 10 years on Capitol Hill, gaining experience working in both a bipartisan manner across the various factions of the Democratic caucus. So Zack, thanks for joining us and for sharing your thoughts on what things are like right now on the Hill, given that we are in the middle of a pandemic and nothing is really the same right now. So Zack, I'll hand it over to you to share your wisdom with us.
Well, thank you, Lindsay. I really appreciate it. And Shelley as well. I appreciate the opportunity to be here. And obviously for all of those who are watching, who are cancer survivors, and those who may still be battling or know folks who are battling, my heart goes out to you. And, every day that I spend on Capitol Hill, nothing compares to the fight against cancer. So the opportunity to speak to the National Coalition for Cancer Survivorship means a lot to me, and I thank you for the opportunity. As Lindsay said, I was on Capitol Hill for about 11 years. Started with Jim Cooper of Nashville, worked with him for about 6 years, and spent the last 5 years with Congressman John Yarmouth of Kentucky. Did a lot of healthcare work, and got the ability to work with Lindsay in NCCS, and I do miss it. I've been off the Hill for about 1.5 years now. I do miss being up there, though. Right now, what you see on Capitol Hill is a lot different than what it looked like even 4 months ago. Life in the age of COVID-19 has really changed the way, obviously all of our lives are different. Everything we do is different. And Capitol Hill is just like that. You look back in February, the things that Congress was looking to work on were things like reauthorizing FISA and a highway bill that expires at the end of September. The National Defense Authorization Act expires, appropriations bills, all that stuff expires. That was what Congress was going to be focused on. Maybe work on a highway bill, since every week is infrastructure week. But things like that. That was where Congress was going to be focused. However, since the middle of March, Congress has passed 4 real substantive bills, and they've all had to do with COVID-19. The Families First Coronavirus Response Act passed in March. Then about 1.5 weeks later, the CARES Act passed. About a month after that, when the Paycheck Protection Program ran out of money, we passed the Paycheck Protection Program and Healthcare Enhancement Act. And then about 2.5 weeks ago, they passed the Paycheck Protection Program Flexibility Act. So you may notice a trend. It's all COVID all the time. And it's just a whole new world on Capitol Hill. Instead of members of Congress and staffers and tourists and visitors and lobbyists milling about and roaming the halls and the hustle and bustle and sense of urgency that comes with all of that, it's silent. There's no meetings, very few hearings, even fewer markups. The House itself is rarely in session, and if so, not every member flies back to DC for it. The House recently passed a new rules package to allow during the pandemic for members of Congress to vote by proxy, which some 60 members utilized the last time the House was taking votes. They also can now hold a lot of their committee hearings and markups with a hybrid, either in-person or virtual aspect. You're seeing some of that actually right now. There's a big hearing going on in the Energy and Commerce Committee with a series of health officials from the administration, including Dr. Fauci. They're all doing this kind of weird new hybrid life where you have some people coming in virtually, kind of like we're doing right now, and some there in person. The Senate itself has been in session a little bit more than the House, but they don't really have a whole lot of legislative, outcomes to show for it. They've been focused mostly on filling judicial and executive vacancies, which there are several. If you look at the congressional calendar, the House was supposed to be in session almost all of June and July, but now are only going to be in votes, in for votes for just a fraction of that. They're here this week, but only for Thursday and Friday, as opposed to being here virtually all week. Committees are doing a lot of work kind of in the background to mark up several items to kind of fill up a queue of things to vote on so that when the House is in session, members have plenty of votes to get through to make most of their time and limit the amount of time they have to spend coming back and forth to DC. But those votes now take a lot longer to accomplish. So instead of a vote being a 5-minute vote or even a 30-minute vote, these votes are taking hours because they're only allowing a handful of members to vote at a time, trying to socially distance as much as possible, trying to keep as many people out of the House floor at a time. So this week, as I mentioned, the House and Senate are both working on police reform bills. The House is going to pass a DC statehood resolution, and I think they may also try to get to a bill to kind of beef up the Affordable Care Act. Next week, the House looks like they're going to push their $1.5 billion infrastructure package. But beyond that, instead of what is typically an incredibly busy couple of months, you're going to have a couple of weeks of action in July on the National Defense Authorization Act and the appropriations bills. We could also see action on another package for COVID-19 if the Senate decides to act on it. Other than that, there's not a whole lot going on, and inside the offices themselves look a lot different. There's very few staff on Capitol Hill these days. Most everybody's working remotely. Meetings look a lot different. They're doing this virtual or conference call based, and there's not a whole lot of member meetings, none of the typical fly-ins that you would typically see that you all would be participating in this week. You guys are witnessing firsthand what a lot of folks are starting to learn. And it's different also for members and staff. They're still getting used to this whole new environment as well. Most of what congressional staff were doing back in March and April was mostly casework kind of things, navigating the network of federal assistance programs that were created to help ease the economic and health impacts from the disease. But staffers, they don't have to run back and forth between the office and hearing rooms or have to staff their bosses and meetings throughout the day. It's a little bit quieter for them. Members have a little different world too. Typically they'd be doing a lot of fundraising and campaign work that's much harder to do these days. You see a lot of virtual campaign events instead of dinners and happy hours. Campaigns have totally had to retool how they do their work. They're now living in a virtual world as well, and instead of knocking on doors and holding rallies, which we saw that didn't necessarily go that well for the president this weekend. So it's a whole new world. Campaigns are having to try to learn kind of on the fly. But when we look at healthcare policy as well, there's been a lot of changes there too. And you look at the end of last year and then coming into this year, the focus in the health policy world was on a few major efforts that seemed really primed for action, ending surprise medical bills, reining in pharmaceutical costs, things of that nature. The House and Senate both acted on those efforts and nearly had passed a big compromise at the end of the year, but negotiations fell apart, jurisdictional battles erupted, and that kind of pushed everything, the thought was, into 2020, which is an election year, which makes things difficult to do. But both are very unlikely to move this year. People have been avoiding the kinds of procedures and hospitalizations that led to surprise bills. Pharmaceutical companies that had long been a foe in the eyes of many are now being counted on to save lives and bring people back a simple sense of normalcy. Hospital financing has changed quite a bit. The elective surgeries that tend to be pretty lucrative and help subsidize ER departments have all been dried up. Ambulance companies that rely on taking patients to those ER departments receive far fewer calls because people didn't want to go to the hospitals, or the hospitals didn't want, or in some cases didn't have space for, people who weren't gravely ill. Telehealth, as with everything else virtual in this new normal, has taken off quite a bit. And that's after years and years of policy wonks touting how it would change the healthcare world. But at the end of the day, lost jobs, 25 some million Americans have lost their jobs. That a lot of those folks means they lost their health insurance. And insurers don't really know how the pandemic is going to impact the pricing of their policies in the years ahead. So, we've also learned a lot about the scarcity and importance of PPE and how poorly we were prepared to distribute it in a crisis, and how vital having a strong national strategy is to combating pandemics. So at the end of the day, the question remains, what lessons have we actually learned, and how are we going to be better both in the present and in the future to address things like we're dealing with right now? But one thing is clear, sadly, that even in a public health crisis, we're not safe from an incredibly polarized political landscape. So how was that for uplifting?
Thanks, Zach. Well, I know Lindsay and I have some questions for you, and maybe the audience will as well. Please feel free to use the question or chat box if you have questions for Zach. So thank you for that overview. Not too uplifting, but I think it's really important for people to understand the climate on the Hill and what's going on. I have a couple of questions. One is, so you mentioned that there was this bipartisan cooperation to get really huge legislation done in a record amount of time to get those 4 bills out. Do you see that there's still any appetite for that bipartisan cooperation, or are they at the end of their willingness to cooperate at this point, especially as we get closer to the election?
Yeah, well, that's a great point. Let me to add a little color to that. I was on the Hill back during the economic collapse of 2008, 2009, and I remember the stimulus that President Obama pushed through Congress. The big fight was, oh my God, we can't have it be $1 trillion. Like we can't $1 trillion. We can't do that. It's got to be less than $1 trillion. So they scaled it back, and which probably wasn't good for the economy, but they had to scale it back just because of the political will of passing something that had $1 trillion price tag. And now we're just throwing trillions of dollars around like it's nothing. And it's important. Don't get me wrong. I'm glad we've spent that, but I do think we're going to see another package. I think the unemployment numbers that were both surprising and a little baffling that came out about 3 weeks ago. I think that kind of tamped down some of especially on the Republican side, on the Senate. They'd rather not spend another $1 trillion or $2 trillion if they don't have to, and if you continue to see job numbers I say improved, but they're still the worst numbers we've seen since the Great Depression. They're bad. These are not good numbers. They're just not as bad as we were expecting. So I do think we're going to see something. You still see the White House even today was talking about how they would like to see, maybe another round of stimulus checks. The president's been talking about another payroll tax cut, which just isn't going to happen. But the bipartisan response is different now. The House, it's been a couple of months ago, passed the HEROES Act, which contained $3.5 trillion in healthcare funding and stimulus, economic stimulus and protections for people who'd lost their jobs and things of that nature. That's not going to go anywhere in the Senate. The House knew that it wasn't going to go anywhere in the Senate, but it was an opportunity to kind of make their first, what they thought was their initial negotiating position, not expecting another 2.5 months to go by before any kind of action happened. I think what we're still going to see, states and local governments are in real bad shape. Their revenues have dried up at the same time when they have, a lot of healthcare needs and unemployment needs and things of that nature. So the federal government has helped out on that front to a degree, but at some point there's going to be the state and local governments, they don't have an ability to not balance their budgets. So they're going to run out of money, and it's going to take some federal intervention. So I do think we'll see something. I doubt we're going to see anything till probably, I wouldn't expect a whole lot of negotiating to start until the middle of July, maybe to not see another bill till the end of July, maybe the very 1st of August. But I do think we'll see some other action.
Great, thank you. I have one question from an audience member. Is many patients benefit from groundbreaking research funded by the Department of Defense's congressionally directed medical research program. When do you see appropriations being marked up and finalized? And what is the outlook, I guess, for appropriations this year with everything else going on?
Yeah, well, just as everything else has changed, the appropriations season will look a whole lot different than it was originally expected to look. I think Leader Hoyer on the House side had hoped to have all the appropriations done by July. Obviously, they haven't even marked up anything in subcommittees yet, so that's not going to happen. The subcommittees are planning to hold these unbelievable marathon sessions over the course of a couple of days to mark up all 12 appropriations bills. I think that's on the 7th and 8th or 8th and 9th of July. And then the House will be in session the last couple of weeks of July to pass those. But let's be clear that what's going to happen is you're going to see probably a couple of omnibus packages. So instead of voting on 12 appropriations bills and having an untold number of amendments and things of that nature, they just can't do that. Like they don't feasibly, you cannot do that when votes are taking an hour or two to do. You can't have 75 amendments. There's just no time. So I would imagine you're going to see a couple of omnibus packages. And then at the end of the day, we're probably going to see some kind of continuing resolution. I don't think we're going to see anything pass both the House and the Senate, get worked out and go to the president before the end of the fiscal year. So I'd imagine you're going to see a CR that will probably last until sometime in November, maybe December, and then make it a lame duck effort. And then depending on where the virus and everything is at come the fall, that may get punted into next year, which could be an entirely new administration, who knows? So, but that's what we're going to see. We will see some action, but at the end of the day, I think we're just going to see a continuing resolution and maintain the current levels of funding.
That makes sense, because even without a pandemic in an election year, their legislative days are pretty limited before they get out of town to go campaign. But of course, campaigning is totally different this year. So I'm going to ask one more question from the audience. I'm sorry we're not getting to all the questions that were asked, but and I'm going to add on to this question from one more thing. So the question is, based on the current situation, do you think our meetings will be productive? Will they be interested in healthcare? What can we expect? And I'm also going to ask you to add on, like, what is your, and I know you're going to talk a little bit more about this in the breakout session following this, but what's some advice on making a phone visit as effective, because people are used to coming into a meeting in person?
Yeah, I think the most important thing is, I don't think you guys will need to worry about, there is a lull, right? It's a little different when you're not face to face. When you're on the phone in a phone conversation or a Zoom meeting or something like that, it's a little different. But I think you telling your story and advocating on what you've had to go through, those are powerful stories, and those stories don't become any less powerful because you're telling it over the phone or you're doing it in a Zoom meeting or however it is you end up doing it. Those stories are powerful regardless. It's actually, I think these meetings will be effective. I think tailoring it to being a vulnerable population, which is something that everybody's focused on with COVID-19, I think that gives you a hook to really discuss how this is affecting you and your concerns. But telling your story, those are powerful stories, and they will remain powerful stories no matter the medium in which you're expressing them. But yes, I absolutely think these are going to be important, and these are going to be good. One of the things I touched on earlier is, because staff don't have to run back and forth to committee rooms and hearings and markups and things of that nature, they do actually have a little bit more time to focus on these things. And you're talking healthcare. Healthcare that's a big focus right now. So you're not coming in to talk about ag policy or things of that nature, which is still very important, don't get me wrong, but may not be nearly as top of mind as healthcare is right now. So I absolutely think this is an excellent opportunity for you. And again, just tell your story, be authentic, and let them know what you're feeling and what your thoughts are. And I think that's very powerful.
Thank you, Zach. And, we heard advice from another Hill staffer that, they're really so focused on COVID that if you want to come in to talk about even something healthcare related that's not COVID, you're going to have a harder time getting their interest. Although he acknowledged that, at some point we're going to have to listen to those other, issues as well, and not just focus on COVID. But he talked about the eye roll if you come in asking for something that's completely unrelated. I will say that we're going to get into this a little bit more when we move into our presentation, but the asks that we're asking you to talk about we have tailored them to COVID. One is specific to COVID, and one is care planning that we've worked on before, but we've tweaked the messaging to really talk about why it's even more important now during this situation. So we'll try to help that to make it more relevant for those staffers who are maybe less interested in hearing about non-COVID related healthcare, although, it is part of their job, and it's, they do have to address issues that are not just COVID related, but I think that's still their primary focus right now.
I will also say from some of the staff that I've spoken to, there is also a little bit of they're all tired of talking about this too, though. Like, when it comes to COVID, it's been COVID all the time. And, in terms of public policy outside of the kind of social distancing and things like, we don't have a vaccine yet. And until we do, those are the kind of things that, there's not a whole lot else we can talk to on a policy front that hasn't already been discussed. And certainly not on one that you can do from a federal level. And so there is to some degree, from some of the folks that I've talked to, that they're a little tired of of this and don't necessarily mind talking about something other than COVID. But I do think as a general point, you have a very easy hook being an endangered population, and one that is far more at risk due to the coronavirus. I think you've got an excellent opportunity to make that case that what you have to say is very important in light of the ongoing crisis.
Great. Thank you so much, Zach, for your insider's wisdom. It's always helpful to hear from somebody who has that long-term Hill experience and can kind of give us the inside scoop. So now we're going to move into, we have a few slides that Lindsay and I are going to present to talk about what we're going to be talking about on the Hill. And then Zach is going to be in one of our breakout sessions to do some mock meetings after this session. So we really appreciate your time and your support of NCCS, Zach.
Thank you.
So if we can pull up our slides now, we will get started. So how Congress works, we're going to spend not very much time on this because Zach has already told you, and how Congress usually works isn't how they're necessarily working right now. But next slide, please. This is sort of accurate, even when you're not in a pandemic, that it doesn't always work that well. I think it's become so increasingly polarized and partisan, unfortunately. And while, as Zach told us, the pandemic helped bring the two parties together to do some important relief packages, it's they're really struggling to get other work done. Next slide. Just a quick reminder that in the House you have 435 members. They are elected every year, so they're always in election mode. And then the senators, 100 senators, 2 per state, and that a third of them are up for election every 2 years. So only a third of them, and you can definitely check easily to see if your senator is up for re-election this year, and if so, that changes their calculation about how they look at things, and if they have a tough race. And there's definitely a handful that are going to be tight races this year, and some that won't be tight at all. So it probably doesn't affect how they do things. Next slide. You can see here's the breakdown. The House of Representatives, as you probably know, is controlled by the Democrats since the 2018 election, with Nancy Pelosi as the Speaker. And the Senate is still controlled by the Republicans, with Mitch McConnell as the Majority Leader. And you can see the breakdown there of members from each party. Next slide. I love Schoolhouse Rock and I'm Just a Bill, and how a bill usually becomes a law is it's introduced into committee, there's committee hearings and markup, and then a vote, and then it goes to the full chamber for a floor vote. So we're going to be talking about the Cancer Care Planning and Communications Act, which has been introduced, has been sent to the Energy and Commerce Committee. It has not been marked up. And as Zach said, that a lot of the committee action is really moving pretty slowly, or there's few hearings going on right now. So still, it's important to let members know what's important to us, but it's sometimes, there's so many bills that get introduced every session, and it's just hard to get their attention on ones to get them to move it on to the next stage of that progression to markup hearings and markup. Next slide. We've already talked quite a bit about the pandemic's impact on cancer care in other sessions, but since one was a breakout and you might not have attended, we know that that COVID-19 has really reduced screening rates for breast cancer, colon cancer, prostate cancer, although there's been efforts to try to resume some of the screening programs. There's still important modeling that's going to show an increase in mortality for these cancers because of the reduced screening. Shift in site of cancer care with the use of telehealth, which we've talked quite a bit about. And then some of the long-term healthcare system effects of the pandemic, and potentially leading to more consolidation across healthcare systems, and potentially even increasing the already underway movement away from volume-based care. Next slide. We talked, Lindsay, are you going to take over here?
Sure, yeah, I can take over here.
Okay,
Or if
great.
you want to keep going, you're on a roll.
No, it's all right.
I almost jumped in to sing "I'm Just a Bill," but I'll spare everyone my wonderful singing voice. So thanks, Shelley, for giving us the Schoolhouse Rock rundown of how Congress works, and for Zack giving us that really insightful information about what's going on right now. So I'm just going to dive into what our Hill asks are. And so first, I just wanted to check out the poll results that you guys filled out earlier, so we can see how many of you have met with your members of Congress before, or if this will be your first meeting. So if we could bring the poll results up. So it looks like we have a really nice split between a majority of folks who have met with their members of Congress before, but there's still a really nice large percentage of you who are new to advocacy and haven't done that yet. And so as we kick off Hill Week, I hope this gap narrows and that most of you get to talk to your congressional offices over the phone. And then we're going to spend the rest of today just making sure that you're prepared to do that. And so back to the slides. As Zack mentioned, there have been 3 very large packages passed recently, and then the House passed the HEROES Act, but the Senate declared it dead on arrival. So we're still in the very early stages with that legislative package, but I am glad to hear Zack predict that there will be another package passed at some point to address the ongoing impact of COVID. So next slide. So now to give you some context for our Hill Week asks. This year, we're urging Congress to expand paid leave to include people with chronic conditions like cancer during COVID-19. And then we're also asking Congress to pass the Cancer Care Planning and Communications Act, or the CCPC Act. And for those of you who joined us last year, it's the same legislation, but given the disruptions in cancer care, we feel like it's even more important now that care planning is included in the next package. So I'm gonna now dive into the specifics of each of these asks. So next slide, please. So for the paid leave expansion, so for many people living with chronic health conditions, the pandemic is really magnifying existing financial and logistical burdens associated with their care. And I'm sure many of you know that all too well. And so currently, only people with childcare needs and parents of adults with disabilities impacted by the pandemic are really eligible for the paid family and medical leave under the expanded emergency use of the FMLA that Zack mentioned earlier. And so this policy still leaves out many who, because of a serious health condition, might require time away from work due to the risks that COVID would pose to their health or the health of a loved one. So as Congress develops the next legislative response, we are asking them to ensure that people with cancer and those people with cancer whose providers recommend that they stay out of the workforce receive job protection and financial support that enables them to stay at home. So next slide, please. So it's always critically important to share how each policy affects patients. And so patient stories are critical in highlighting and illustrating the need for any policy change. And so we have a patient story here that really highlights the need for this policy. And it's actually a patient that Shelley spoke to. Shelley, do you want to talk about Melissa's story?
Sure. So Melissa was diagnosed with Hodgkin's lymphoma when she was in college, and she's now more than 30 years out from her diagnosis. She works as a respiratory therapist. As some of you know, that people who were treated 30 plus years ago with Hodgkin's lymphoma have significant comorbidities as a result of their treatments. She's had bilateral mastectomy. She had emergency heart surgery a few years ago. She has a number of risk factors. So when the pandemic first started, she actually took an unpaid leave of absence from work to care for a family member who was no longer covered by their care situation. And then when her leave was up and she was looking at returning to work, she was very worried about exposure to COVID-19 patients because she works as a respiratory therapist. She loves her job. She's very committed to it. She has really specialized training and doesn't really have a lot of other job opportunities, and she needs her health care. So she wanted to go back to work, but she asked her employer for an accommodation to limit her exposure to COVID-19 patients, and she was denied. She did have a letter from an oncologist who was not her own oncologist, but it was a letter talking about the immunocompromised issues that she faces, particularly with the long-term Hodgkin's. And so she said that I feel like I'm walking into a war zone. It's a very stressful time. I don't feel safe. I feel like I'm playing Russian roulette every day. Her employer, I think, felt like she had to, they couldn't give her an accommodation without accommodating others who were worried about COVID exposure. And so, she's not somebody who wants to be on disability or not work, but she's really worried going to work every day, and she has to do that. And so what we're hoping is that if expanded paid leave would help people like Melissa, who really don't have the option to work from home or to work in a protected environment and have these significant health risks.
So Melissa's story is a really powerful one, and obviously really articulates the need for this policy change. But we realize that not everyone is going to have this same story to share in their Hill visit. So in track 1, the breakout session today, telling your story in a nutshell, the presenter has an excellent worksheet, a couple worksheets that is really going to help you articulate the asks clearly and concisely. And so she'll help you craft your message, even if the paid leave expansion wouldn't apply to you personally. It would help you say that, I'm fortunate because I'm able to stay home or I'm able to work from home, but not every cancer survivor can. And here's a story of a patient who is really negatively impacted by this. So that's still incredibly helpful. So let's go on to the next slide, please. And so our next ask is one that I mentioned that we prioritized in the past, but we think is even more important now. It's the Cancer Care Planning Act, and it would establish a Medicare reimbursement code so that cancer patients would get a care plan at time of diagnosis and then at any transition point in their care, cancer care. And we have a great one-pager that we're going to be linking to in the chat box that has on one side the paid leave information, on the other side the Cancer Care Planning and Communications Act information. These two members here, this is a bipartisan bill that was introduced last year, and we think now with the need for care coordination and all of the disruptions in care that have been occurring because of COVID-19, that this is a really important policy ask. So we'll go on to the next slide. And that's just more about the CCPC Act. We'll go to the next slide, please. So on to the meeting. So although the meetings are going to be through phone or maybe video conference, but mostly through phone, the setup of the meeting is still really going to be the same. We've been talking about the breakouts because the track 1 and track 2 breakouts, if you're going to be participating in Hill Week and contacting your members of Congress, they will be incredibly useful to you to either help you craft your message and learn how to share your story, or in Zack's session, breakout 2, we're going to do practice meetings. So you'll get a chance to walk through and practice what those meetings will be like. And I think that'll be really helpful. So it's always important to start out by introducing yourself and allowing any other constituents on the call to introduce themselves by sharing your name, where you're from, and your connection to cancer. And then, up front, mention that you have these 2 asks that you want to go over, which include paid leave and care planning, and then go into the details of those asks. And if you feel comfortable, that's a great time to then share your personal story to really, as I mentioned, highlight the need of these legislative asks. And so if you want to practice these asks, join us in breakout 2. And as we've said throughout, all of the sessions are recorded and will be posted on our website. So, you will be able to access both of those breakouts, and I think you'll find them to be really helpful. And everyone always loves the mock Hill meetings. We have a lot of fun. We've learned that Zack is not just a DC insider, but he's a pretty incredible thespian. So he plays the role of cranky staffer very well. And it's really fun too. I think you get to practice and then you'll get, live feedback on that. So that's exciting. So we'll go on to the next and final slide, I think. So many of you, if you schedule Hill meetings, have probably already heard from Rebecca. She is our Hill Week intern, and she has been working really around the clock to schedule the Hill meetings for those of you who signed up when you registered for Symposium. And you'll be getting an email from her with all of the details of your meetings. And like I mentioned, the one pager that we, I think, have posted in the chat box. We'll also send it through email, and it'll also be posted on the webpage. But it's also not too late to participate in Hill Week. So if you haven't signed up yet, but you would like to participate, you could reach out to your members' offices directly and request a meeting. And of course, NCCS is always here to help you. So if you would like our help in securing a meeting for this week so you can participate, we would love for you to do that. And we are always here to help. So I'll hand it back over to Shelley.
Thanks. So if anybody has any questions, please use the chat box. And because we still have a little bit of time, we can talk about any questions you may have. And as Lindsay said, while we're doing meetings this week to coincide with the symposium, there you can talk to your members of Congress office anytime. And as Zack has mentioned, some of the staffers actually have a little bit more time available now because they're not following their member around to hearings and meetings. And so, we scheduled the meetings a little bit differently this year because normally we go through the office's scheduler, but we were advised because of everybody working from home that we should go directly to the health staffer because that's the person that you would be most likely to talk to, and that would be the best person to hear from you. So that's who we've reached out to for your Hill visits. But if you didn't request for us to schedule Hill visits, you could just reach out to the scheduler at the office, and they can help put you in touch with the right person, or you can be in touch with Lindsay and Rebecca, and we can get you the health staffer's name. Yeah. Zack, I know you're still with us. We have a couple of questions that I'm gonna pitch both of them to you and let you answer them. What is an omnibus? And how much time will we have to talk with members of Congress? I think at this point we don't think you'll get to talk to members of Congress. You'll be talking with staff. Whereas normally, if you're coming into the office, you have a shot at talking with the member. I think with this virtual environment, we don't really get meetings with the members. But how much time do you think? And then can you talk a little bit more about omnibus?
Yeah, you made a great point about the chances that you'll get to chat with a member probably pretty limited, unless just by chance the staffer is in the office and the member's there, which could happen. Especially, I understand Thursday you guys have some meetings, so that there's a chance, but I would say probably 90 to 95% of staff are working from home, and unless they live with their member, which I really don't think is the case, there's probably not going to be a chance to meet with the member. But I would say you want to be cognizant of their time, the staffer that is. I would aim for 15 minutes. And then if it bleeds over a little bit beyond that, you're fine. I think if you try to plan for like a 30-minute meeting, and then 25 minutes into it, you're only halfway through your presentation, you're probably not in a good position. So I would aim to have everything, get all of the points out, tell your story, do your advocacy and your ask within 15 minutes. It also opens up some time for the staff to ask questions. A lot of you will be telling fairly personal stories, so that you may get some engagement from staff just about how all this affected you personally and things of that nature. So having that interaction is also good, building that rapport with the office and with the staffer. As for the omnibus question, that was me throwing all that Hill jargon around. So an omnibus bill, so the appropriations process, there are 12 different appropriations subcommittees, and each one passes a bill. So for instance, the one that is most important, the couple that are most important to you are the Department of Defense Appropriations Subcommittee and the Labor, Health and Human Services and Education Subcommittee, which is also known colloquially on the Hill as Labor H. Those are a couple of the biggest ones for you, things like NIH funding, the congressionally directed research fund that was mentioned a little earlier. Again, with as long as it takes to pass individual bills and things of that nature, you're going to see what are known as omnibus bills, which is a big package. So instead of just passing one of those appropriations subcommittee bills, they'll package 3, 4, 5 of them all together into one big bill. Unfortunately, that's the way our appropriations process has really been dominated for 15 years now. Instead of doing individual bills, at the end of the day, you're seeing 2 or 3 really large omnibus bills, which is just a package of smaller bills all into one big bill.
Great, thanks, Zach. And we have a couple more questions about Hill Day that we want to just take a minute to address. So we have a couple of folks asking about the leave behinds, and that one pager that I was talking about with the information about paid leave on the front and care planning on the back. That is what you will have that will help you understand the asks, and that also is for what we have used in the past as a leave behind. So you can email that to the staffer after you talk with them. And we also have a question about whether or not there will be other advocates on the calls. And that's a great question. So for some of the Senate meetings especially, there will be other advocates, and that will be included in your email. It will have how many other advocates will be joining that call. And so just be aware that, for instance, if you're from especially a bigger state where we know there are several advocates like Texas or Florida, and I know Virginia has a couple advocates participating in Hill Week, that you will all be on the same conference line with the Hill staffer for your member of Congress or for your senator together. And we have one more question about how do we set up for a Hill meeting at this point. If you are interested in participating in Hill Week but didn't sign up originally, it's not too late at all. You can just reach out to your member or your senator's office directly just by calling them. And we're also happy to help. So you can feel free to email me at lhouff, Houff, at canceradvocacy.org. And we can put that in the chat box as well. So if you need help scheduling a meeting, we hope that even if you didn't originally sign up for Hill Week, but this session has inspired you to take action and participate in Hill Week with us, we would love, love, love to have you. And we're here to help. And one last question about the Hill meeting. So if you have registered and haven't heard back from Rebecca about your Hill Day schedule, you will hear from her by the end of today. So some of those meetings, she's been waiting to confirm all 3 meetings with your member, your House member, and then your 2 Senate members. And so once all 3 of those are confirmed, then she'll send over the information of what time those meetings are and what conference line to use.
Great. Thank you so much, Lindsay, and for organizing all of this, and to Rebecca for helping schedule these meetings. And thanks to Zack for joining us and sharing your wisdom. So now we have a break before our breakout sessions. I just want to say a few words because we're not going to come back together as a group. We have 3 great breakout sessions. One is about telling your story in a nutshell, and some of you have done this session before. It's a great way, as a cancer survivor, you have so much to say, and in some instances you get to speak for 10 or 15 minutes about your experience. But when you're meeting with a a congressional staffer and you've got the whole meeting is 15 minutes, you've got to really kind of hone your story to be able to tell it in a nutshell. And Margot Friedman will give us a great overview of how to do that and a worksheet to help walk you through it. And then we also have the session on mock Hill meetings with Zack and Lindsay. And finally, we have a breakout session called A Few Good Men, because we really want to increase the number of male advocates, cancer advocates that are engaged with us. And we have 3 wonderful advocates who are going to lead a discussion and talk about how we can do better to recruit more men as advocates so that we can make sure that we're representing the needs of all the cancer survivors that we serve. If you're doing Hill visits, you can definitely choose one of the 2 sessions that will prepare you for that. And then later today, when the sessions are posted, you can go back and watch the other one, because I think they'll both be very helpful to you. And we will share the links to the information, the worksheets for telling your story, and the 1-pager for the meetings. Before we close, I just want to thank all of the NCCS staff who worked tirelessly to put this together. This is new for us, doing virtual meetings, and we had a great group of people helping put this together. Thank you to the folks at Dufour Productions for helping us put on this event, and to Elizabeth Goss, who provides us policy counsel and helps us with all of our policy efforts. I'm really grateful to work with such an incredible staff, and thank you all for your work. And then thanks to all of you for joining us. I know that there's a lot going on, that there are other important cancer-related meetings, and people are choosing between meetings or going back and watching archive sessions in their spare time. But we really appreciate you being with us, and we appreciate all of our supporters making this possible. We look forward to having you all in person again soon, whenever it is safe to do so from a public health standpoint, but we will still be here working for you and with you during this pandemic and until we can meet again. Thank you very much for joining us, and we'll see you at the breakout sessions at 1:30.